Hi guys, sorry about the 2 holidays this semester, but we are going to work through it, and because of that we're going to have a take-home test for the reproduction module. But because of that, even though we're not covering it in depth in class, I still wanted you to have a video access of kind of like a lecture environment. So I still want to go through the reproduction module. When we talk about canine reproduction, our first part of this module is going to be related to dogs. And at the end of this module, we're going to talk about some differences between canine and feline reproduction. In general, look at this cutie patootie. You probably know him as the Floyd. In general, dogs are going to reach puberty at approximately 6 months of age. We say approximately because some breeds mature slower than others, but in general, on average, 6 months of age. At this time, females are capable of going through their first estrus cycle or their first heat cycle, and males are capable of being sexually reproductive at this time. Remember that dogs are, a purpose of reproduction is to hence make a baby, and unlike humans, don't do it for pleasure, and reproduction as well. The estrus cycle, this is going to be a reoccurring periods or their menstrual cycle, and hence at this time females are able to become sexually active and receptive. So sperm cell, egg, going to fertilize and make a baby perhaps. Dogs are monoestrous versus, this is one big difference between dogs and cats, but which means that mono means one, estrus cycle, so during each breeding season they are capable of having one estrus. We are going to review the estrus cycle, the 4 distinct stages of the canine estrus cycle. And when we do this, we're going to look at a variety of things. We are going to look at the gross examination of the female, let's say their vulva, their external genitalia. That can be very helpful in identifying what stage they are in. We don't use that just by itself. We're going to compare the vulva to its appearance to any discharge that they might be, that you might see. We're also going to match that with the behavior that the female is exhibiting. That can also be very helpful. And what else can be helpful is understanding what the ovaries are doing at that time, so the ovarian activity. When we go in and collect a sample of the vagina, the inside of the vulva is the vagina, and we can look at the cytology of that, like you did in veterinary diseases, and we can see distinct cells for each stage of estrus. We can also review the main hormone that is responsible at that distinct stage. So if you are in a reproductive facility, you may look at drawing a blood sample and submitting for a hormone level to see if that is going to influence you in understanding what stage of estrus they are in. And we're also just going to review average length of time. Of course, we covered these 4 stages of estrus in BLP, remember when you were in that class, and also veterinary diseases, so and comparative anatomy. So this is a nice review. Again, here's just a picture of vaginal cytology, the actual procedure that you did in veterinary diseases. You took a sterile moistened swab. You moistened it with sterile saline because you're going into a sterile cavity. Beforehand, you can look at the vulva again, appreciate is there any swelling or discharge, and if so, what color, what is the consistency of the discharge. You can clean the external genitalia because again, we're going into a sterile cavity. We wouldn't want to cause an iatrogenic infection. We go in somewhat at a 45-degree angle. We're going to hit a barrier, we're going to hit a wall. At that time, we're going to advance it more horizontally. We're going to rotate our sample collection device, and we're going to pull it back, and we are going to transfer our cells carefully and cautiously onto a clean glass slide, of course labeled. So a quick little review, with the female genitalia, the urethra and the vulva are in a similar area, so again that 45-degree approach will be confident for you getting into that vulva and not this hole. That's a different orifice. Here are the 4 stages. Anestrus. A or an in front of a word means with or without, and so this is where you're not going to see any activity. Any activity meaning the female is not going to be interested in breeding, the ovaries are not doing anything, there's no hormonal influence at that time, we are not sexually active. The vagina is just a couple cells thick, and again we are going to see that the vagina is lined with epithelial cells, and as we go through the different stages of estrus, these epithelial cells might appear different. And what they're going to appear like is this classic non-cornified epithelial. We might also know this as a parabasal cell. The vagina is not swollen, there's no discharge, there's no obvious signs to say that we are preparing for reproduction. So if you are a breeder, this is not the time to call in the stud dog at all. In general, this stage of estrus is going to be the longest one. On average, for the average dog, last less than 6 months. So again, minimal cells, and what you do see are going to be those parabasal cells. You could see a couple white blood cells because white blood cells are on patrol at all time in all cavities of our body, but not a lot of them. If you did see a lot of them and you did appreciate this was in anestrus, we have some sort of infection going on. Again, no influence. Excuse me. Proestrus. Pro means before, and so you can assume the next stage, estrus, is going to be the breeding, the active stage where breeding and reproduction can occur. But right before that, proestrus is going to be the stage in which we are preparing the uterus for possible implantation or preparing the body for reproduction. So we've got this sanguineous discharge, bloody discharge. Now again, you might not see bloody discharge because what if you have a female that is very clean and hygienic? She might be cleaning up that discharge. Because there's blood, you can associate some some vulvar swelling. That will be obvious. This is going to imply that we are preparing acceptance of that male. The vagina is preparing for possible implantation. It's getting thicker and thicker. Estrogen is going to be your main hormonal influence at this stage. So the ovaries here are, what is happening is the follicle is beginning to develop. So if you were drawing a blood sample and submitting it for an estrogen level, it would be a little bit higher than normal. Proestrus, here are some pictures of the vulva. This is not a lot of inflammation present in this picture, but if you knew what the normal vulva would look like on this dog, you would be able to say that it's a little bit swollen. On average, for the average dog, can vary of course, but on average we have a little bit over a week. Now, if you are a breeder and you are the owner of that bitch dog, that female reproductive dog or breeding dog, you have to be aware that proestrus lasts on average 9 days. The next stage is estrus. You have to get that stud dog ready. You have to call that stud dog, not the stud dog itself, its owner, and say, I need you to be available pretty soon. On cytology, you collect your specimen. Your most predominant cell is going to be your red blood cells. What is happening with these epithelial cells is from anestrus you had this parabasal. They are slowly going to transition into your cornified epithelial cells. So you go from a non-cornified to a cornified. At the beginning of proestrus, they're going to be non-cornified. At the end of proestrus, they're going to look much more cornified, very angular in appearance. Again, white blood cells can be present on patrol at all times. Estrus, here's the real deal, the standing heat. In proestrus, I failed to mention, behaviorally, that female is going to be kind of like a tease dog. She's going to show interest to the stud, but when he tries to mount her, she's not going to be very compliant. So that's why I use the word tease. But on the other hand, in estrus, she is going to accept it. So she is going to stimulate him. She is going to, and hence, be receptive. She allows the male, accepts the male, and will allow when he mounts her. This is the very fertile time. So if you don't want your dog to be bred, this is not the time to introduce it to a male. The main hormone responsible here is going to be luteinizing hormone. And again, you're going to have a peak time of luteinizing hormone, so you can measure it to see if you are in early stage of estrus or late stage of estrus. The vulva is going to be swollen, but it's not going to be as hardened as what you saw in proestrus. The red discharge in proestrus is now going to transition into a straw-colored discharge. And here you can see in this picture, the tail was up at one time and now it's flying to the side. This is a sign to say, you know, male dog, I'm interested. On average, this is going to last only 9 days. So again, you want to have that breeding dog, that male dog here, at early estrus so you can maximize your time. You are going to breed this dog. If you're interested in breeding, you're probably going to have a male dog mount her every other day, and that's going to ensure successful breeding. Excuse me. In estrus, again, your most common cell seen is going to be your cornified epithelial. Cornflakes, very angular. Nice review from the other classes. There's little to no red blood cells. Now, granted, if you went in with your vaginal, your swab, and you're a little too aggressive, or if she moved, that could certainly cause a little red blood cells in your sample. But if there was no trauma in collection, there's unlikely to see red blood cells. Diestrus, here is if we have had successful breeding, that's one thing. If we did not breed the dog and no possible fertilization has occurred, we're going to talk about some differences here. But in general, the ovary is now going to secrete progesterone. This is going to be your main hormone in maintaining pregnancy. So if pregnancy has not occurred, progesterone is going to decline. If fertilization has occurred, we're going to have formation of a corpus luteum. That in itself is going to maintain that pregnancy. Signs, she's no longer interested, and so if he tries to mount her, she is not going to be very compliant. She's going to be very aggressive. Say, I'm not interested. Pus may be present. Again, you may or may not see it because if she is cleaning herself. On average, this is going to last a couple of months. Early diestrus is going to look cellularly. The most common cell seen in diestrus, early diestrus, is going to be your white blood cells. Think of what they do. They're cleaning up shop. And this is true with or without pregnancy or implantation of an egg. Late diestrus is going to look very similar to anestrus, and so your most common cell here is going to be your parabasal or your non-cornified. So again, in early diestrus, they're going to look cornified. In late diestrus, they're going to look non-cornified. Again, you can have plus or minus red blood cells. That can also be influenced by your collection method. Pyometra. Pyo means pus. Mitra in the uterus. And so in diestrus, also known as metestrus, 6 of one, half a dozen of another, pyometra can be a common occurrence during this time. Again, pyometra is something we're going to talk about a little bit later on in our reproductive diseases, but we have a vaginal discharge. We have that pussy-like discharge coming out of that cavity, that genitalia cavity. We're going to talk about in situations where this can be an emergency situation, can cause septic shock, which again, we've talked about shock can be very devastating. When this slide here is for you to be reminded of, it's not common for you, if you are breeding, a person interested in breeding their dog, you don't just bring your female dog in once to look at the cells. It's very rare to say, shabam, you are in this stage early proestrus, this stage early estrus. You want to look at a variety of things, so many pieces of the puzzle. You might draw a blood sample to look at the hormone level. You might look at cytology. You will look at cytology. You may look at a hormone level. You will look at the gross exam of the vulva. But you typically will look cytologically now, a couple days later, possibly a couple days later, and compare your findings. So here's just a review of those hormones that we talked about in each of those distinct stages. Now, if you're trying to prevent pregnancy, well, the safest way of doing that, and a common way of doing that, is to spay your animal. If you want to terminate pregnancy as well, you may also want to spay your animal. But if you want to postpone estrus, you may want to put your animal on some sort of birth control, just like very common in people. But many reasons. You have a dog show or a field trial, or you're demonstrating the talents of your animal. You want them focused on that given task versus focused on reproduction. And so here are just a variety of reasons. Hunting dog, if they're just interested in finding a female, they're not going to necessarily be too interested in doing their task. Here are some drugs. Some of them might be very commonplace, some names that you might know. Depo-Provera is a very common human contraceptive, and ultimately we can also confine the animal. Here's some signs of puberty in the male dog. I purposefully had Floyd neutered a little bit early because I didn't want him to go through these stages. Again, one being aggressive. I don't want him to display those behaviors to Phoebe, to Gary or myself, or any of the neighbor animals or people. I didn't want him spraying things, especially around the house. So by neutering him or castrating him, orchiectomy is the politically correct term, and I purposely neutered him at about 4.5 months of age, not me, Dr. Hulse, to avoid these qualities or these behavioral features. When you're breeding an animal, there's a lot of things you want to take into consideration. And in this test, you're going to be researching some pre-breeding health conditions, some genetic health conditions. But we certainly know from parasitology that a lot of animals can be born with worms, but we can prevent a lot of parasites by doing some worming ahead of the time. If we want to make sure the animal is up to date on vaccinations, but given some breeds, there are specific things that we'll vaccinate the animal for. In large animal, you'll talk about vaccines in animals that you give before breeding. And that's true for dogs and cats as well. Excuse me. The brucellosis test is I would say common. It's not it's common in breeding kennels, but not common for the average animal. Brucellosis is a bacterial infection caused by Brucella canis, and if a stud dog or a female bitch were to be infected with brucella, it can cause infertility, it can cause abortions if she does actually get fertilized, and in the males it can cause some testicular issues. Many breeds of animals have a genetic predisposition to hip dysplasia, and ideally you want to rule that out at post 2 years of age, and you'll do that with OFA radiographs, and that's something that you'll do in imaging class. Many dogs have eye problems. Look at Phoebe and Floyd. They have that classic ectropion. I wouldn't breed them because of that. That is a trait that is genetically communicable. Communicable is like a word, transferred to their, it would be obvious in their babies. Dentition, bite dentition is not a good quality and to pass on to other litters, and so you'd want to look at the dentition or the bite pattern of both male and female to see if that is something that is transferred. Diseases, allergies. Many of you might have allergies, and where'd you get it from? You're assuming that it probably was genetic. A lot of qualities, diseases that people may struggle with, animals may struggle with, and are also communicable. Temperament of the animal. If you have an aggressive animal, it could certainly be passed on to their into their offspring. Deafness is something that is genetic as well, and you can have bilateral deafness, or you can have unilateral deafness, and that is something that can be tested for. It's not a test in which, like humans, where you put your hand up and down once you hear the little noise in your ears. Animals can't follow that test very well, so there's another test to diagnose it. There's a lot of things that genetics can pass on. Here are just a few. Here's the brucellosis test. It's an agglutination test, and so it's one where you look for clotting. It's an easy test. You just grab a blood sample. Yeah, and ELISA technology. Here's an example of an OFA, Orthopedic Foundation Association. That is the organization that you will submit your radiographs to with information about the dog, and they look at it, board certified radiologists, but they won't certify your dog until, they won't say that you are hip dysplasia free until you're 2 years of age, and they will give you some paperwork to say that you are certified OFA free of hip dysplasia. Here's some pictures of entropion and ectropion, different sorts of bite pattern. Ooh, I wonder what sort of bite pattern that is, and do you see any other abnormalities there? Again, genetic diseases, especially things like allergies, we know that those are passed on to young. Temperament of the animal. Again, it's not to say if you have an aggressive animal, all of the puppies are going to be aggressive. It's just one possibility. When we are interested in breeding, you may also want to collect a semen specimen. And when you do, you are ejaculating the animal. Usually you have a teaser dog in front of this male dog to help with stimulation. You want to do it into a sterile collection device, and once you do that, you look at the gross examination of the semen. It naturally should have a milky white color to it. It should be kind of viscous, like egg white, and depending on the size of the animal will depend on the normal volume. You are going to do some microscopic tests. One of them is going to be a count, and you're going to use this fancy hemocytometer for you to do a count, because again, if you were collecting a specimen and you only had 2 sperm in it, well, that's not a good specimen, and so maybe this dog is not a good stud dog. You also want to look at the morphology of the sperm. Are they very mobile? So are they fast or are they slow? You know, those slow guys might not be the best breeders. And also, you want to look at the morphology of the sperm. Does each sperm have one head and one tail? If you're seeing a large quantity of sperm, even if they are very mobile, moving around very fast, do most of them have 2 heads? That might not be the best candidate for your stud dog. Many breeds don't have successful reproduction, and so they might pursue artificial insemination. And we have a couple very good clinics that specialize in reproduction, and one of them is at Inver Grove Heights, and the other one is at the University of Minnesota. So again, just like in people, if they're incapable of fertilization through natural methods, they might want to pursue artificial insemination. Obviously, you'd have a specialist doing this. Again, timed breeding through understanding your stages of estrus is very important. And again, we can look at hormonal levels to ensure that we have successful breeding. Because what if you have to pay $5,000 to get that stud dog here? You want to make sure that it is successful. Here are just some pictures of the tie. Tie can last very briefly. It can last a long time. And that's where you have penetration. In general, gestation, you learned this as SAM1, on average is going to last about 63 days on average. So if you understand when conception occurred, you can time it and prepare for pregnancy or for whelping, delivery of those babies. Of course, the female's health is going to definitely influence how many eggs were fertilized, and how was she able to house those fetuses for 63 days on average? Are they able to survive that length of time and to be delivered successfully? We can palpate the female's abdomen at about 3 to 4 weeks to determine if she is pregnant and perhaps how many fetuses she has. We can radiograph them after approximately 43 days, and we can count the number of fetuses. You don't want to take too many radiographs, because that's obviously radiation. And same with ultrasound. We can ultrasound them a little bit sooner than that of radiographs. So on average about 4 weeks to determine how many fetuses we have. We want to switch the bitch's food to a diet that has a lot more calories in it, because obviously she is supporting not only herself but probably multiple babies. And so an easy way of doing that is to switch her to a growth formula or a puppy formula. That's true for cats too. If you wanted to terminate pregnancy, we do have some drugs available. And so that, again, you could talk to your veterinarian. Some of them are no longer available. This was really common, this mismate injection. You had to, if you did catch your female dog mating with a dog that perhaps you didn't want it to, that's how my brother got his dog. He bought this purebred black lab, and it wasn't a purebred black lab, and he was able to get his money back. They kept the dog. It was a great dog for many, many years. But obviously the bitch was able to breed with the black lab, but obviously breed with another dog that wasn't planned. Diethylstilbestrol is a drug that is a way of terminating pregnancy. So again, and another way is to spay the animal. Here are some other drugs. And then here we have an ovariohysterectomy. Now, usually many veterinarians will spay the animal early on, but some of them will spay late in the pregnancy as well. As we age, fertility obviously decreases, so I wouldn't be a good candidate for breeding considering my age. A lot of variables here. Most of the resources will say that animals will produce their most ideal offspring before they reach 4 years of age. Now, if you had a Great Dane or a giant breed that doesn't necessarily have the longest lifespan, that wouldn't necessarily be true for that breed. We should spay the animal. Obviously, we want to reduce animal population, so we spay the animal as early as we can, but after you are done breeding, an ovariohysterectomy should be performed. The older they get, the more problems associated with spaying. Again, some people will breed their dogs twice a year. Some believe that it should only be done once a year. Less stressful for the animal. Do not breed until second heat. Some people will breed right away, so right into their first heat cycle. Some people will let that first heat cycle pass and breed after that second heat. We don't have menopause in dogs. They only have the higher incidence of pyometra, that pus in the uterus. Parturition, whelping. This is the birthing process. Parturition is just a general term for dogs. A more common term is whelping. And delivery, parturition has 3 distinct stages. We have the first nesting stage, and this is going to have some distinct qualities. We're going to talk about some distinct characteristics in the delivery phase. You can imagine what that is. And then the third distinct stage is expulsion or delivery of the placenta. The nesting stage, this is where the dog is going to prepare for breeding. It can last very short. It can last just like less than an hour, or it can last many hours. But here she becomes restless, and this is true for people as well. Depending on her behavior, she might just want to go into a closet, into, let's say, a laundry basket, and seclude herself from everybody. Or you have some dogs that seek out other people's attention. Something is happening, and so they're really restless and at their owner's feet. You'll see a common quality where they're going to build a nest. That could be with toys, that could be with blankets. She is going to have her body temperature drop a little bit, just a little bit, one day before whelping. And so again, that can be a key feature of understanding that it's coming. We're going to have a discharge appearing here at this site. Things are going to come out of that genitalia. In the delivery stage, this is where we have the pups being delivered. It can last a very short period of time. It can go on for a long period of time, depending on how many pups and how long the resting stages are between each of the pups. Remember, most breeds of dogs are going to have multiples. I know that the world record currently is being held by a golden retriever that had 18 puppies. Water is going to break. Contractions begin. It's no different than in humans. Again, we deliver one pup, and then we have this moment of rest, and that can be minutes to hours, and then another pup is delivered. Breech, although it is abnormal in people, it is quite normal in dogs. If you're having contractions and there are no puppies being delivered, you want to seek attention. And that is true if you have contractions and it's lasting for an hour plus. Call your veterinarian. If you've had a pup being delivered and then no pup, there is another pup being delivered for a couple of hours, seek attention. Remember, usually you have figured out how many pups there are. Here are just some pictures of a border collie going through the active delivery phase. The third stage is the expulsion of the placenta. And so ideally a placenta should follow each pup. There is a lot of controversy as to do you allow the mother to eat the placenta. Now out in the wild you're going to see wolves eat the placenta because it's bloody discharge. You don't want any predators coming to your nest. So instead, to prevent that, they will eat them. So if you know on radiograph or ultrasound or palpation that there are 3 pups, you should have 3 placentas delivered. And usually they come out minutes after the baby has. Now yes, it can cause her some diarrhea, any abnormalities, like if animals should be fed a consistent diet, dogs should be fed a consistent diet. And so this is not something that would naturally be, you would feed your dog, and so it can cause them a little diarrhea. The mother should lick off this sac. So here you have the fetus stuck in that sac. We want to get that membrane out to expose the baby so they can get oxygen and stuff. But she's also going to chew through that cord, cut the cord, so to speak. She's going to immediately allow them to nurse. And again, she may or may not consume that placenta. If the female doesn't do these normal things, you should seek attention, or you could intervene and kind of show mom what to do. If that's not the case, if she is adamant and not allowing nursing, then we need to find another substitute, a surrogate mother. So here, oh, I thought it was a border collie or border terrier, but it does not look to be a border terrier. It looks like some sort of Airedale, perhaps. I'm not sure. And here she is doing her motherly duty. If she's not going to rip through that membrane, that sac, then you do that. Difficult delivery or difficult birth is known as dystocia. There's a lot of reasons why we can have a difficult birth. We can have a uterus that is just inactive, and so that can be due to a lot of reasons. Usually the animal has a high body condition score, hence they're overweight. There's a lot of, let's say there's too much in lots of babies that we can just get too tired. We can have disorders or diseases like eclampsia, which we'll talk about later on. Again, as we age, things degenerate, so we just might have inactivity that way. Psychological, you have that female owner, that male owner just hovering. That can be pretty stressful for the dog. Again, if you are interested in breeding, leave them alone. Check in on occasion, absolutely. We've got a lot of pelvic abnormalities. So the pelvis is too small. The pelvis has had a whole old fracture. There's a big tumor sitting in the pelvis. There's a lot of reasons that could impede or impair that pelvic canal from allowing those puppies to come through. You could have too big of a fetus. We see that in some breeds where they have a big baby. You could have a dead baby, and due to them being deceased, they can be very bloated and can block that pelvic canal. You can have a weird presentation. Now again, breech is quite normal, but what if they're sideways? That would be very difficult to get through that pelvic canal. If you have a hernia, those puppies might not be able to make it. It could block that making it difficult for them to come out. And it's quite common with brachycephalic breeds. Yes, you've got that big, widened muzzle, but they tend to have a very small pelvic canal. Again, it can make it difficult to deliver. If you have had that temperature decline to 99 degrees and no puppies are being delivered, when there is obvious active contractions, then we want to seek some medical attention. We're going to have that veterinarian on the phone, and you might even be transferring that animal to the veterinarian. Or if there are, again, you know how many pups are present and you're not having them come out of the pelvic canal, we're going to seek some attention. Watching some vitals of the animal. Now, usually people don't have a Doppler blood pressure machine in their home while they're watching their animal whelp, but you can look at you can appreciate the heart rate of the animal. You can look at the capillary refill time. You can ask the owner, what are these? Because we certainly don't want to have a shocky patient, because that is going to cause the mother's life is at risk, and with that the puppies. If there's an obvious abnormal smelling vaginal discharge, all of these are classic signs. We need to seek some attention. And the attention would be, again, stabilizing the patient if we are in stages of shock, and then performing a cesarean section. Here are just some pictures of a C-section. Just like in people, we go through the abdominal cavity, retrieve those fetuses, manually remove them from that membrane, and suck out all of the amniotic fluid out of their nose and stuff, and we get them to breathe. And then, of course, get them on a nursing regimen. Here is a female that is actively nursing. This is a lot of energy. I don't know personally, but this is a lot of calories being consumed by these animals. And so remember that to maintain that bitch on a growth formula, which has higher calorie and higher protein needs. In regards to the puppies, it's absolutely critical that you maintain their body temperature. You need to ensure that the environment is conducive to their survival. So you don't want them in a too cold of an environment. You want them to remain warm. Warmth is necessary for their survival. And if that is not being done, you want to supplement some heat to them. Warm water bottles covered with a towel. You don't want them to overheat. Because again, you have to be careful. They can't move. They're incapable. Their eyes are shut. Their ears are shut. They can't walk. Puppies cannot. And so they can't walk away if it's too hot. Again, their eyes and their ears are going to be closed until approximately 2 weeks of age. They're not going to be able to see till just upwards of a month. And they're slowly going to become mobile by 3 weeks. It's kind of cute seeing them walk at that time. They kind of look like drunken sailors. If their mother is not available, maybe she wasn't a good candidate for mothering, so she rejected the puppies, or if she perhaps died, unfortunately, or if these puppies were found orphaned for one reason or another, if the mother is not present, you need to supplement nutrition to them every couple of hours. So you have to wake up in the middle of the night every couple of hours and support them nutritionally. If you are feeding them, you need to stimulate urination and defecation. And because they're not going to do that manually. So to stimulate them, you're just going to take a little gauze square and you're going to rub their external genitalia and then clean up after them so that urine and feces is not on their skin. By upwards of a month, we can start to wean them to solid food. And again, your veterinarian can help you choose an appropriate diet. A Hill Science diet has AD, which is very high in calories, and it's kind of this slop consistency what the animals tolerate. And again, socialization is absolutely critical. We need to get them socialized with other dogs, other animals. Disorders. So some common disorders you can see in the female dog. We've just mentioned pyometra. We're going to talk about false pregnancy and mammary tumors, breast tumors, eclampsia and mastitis and prolapse of female genitalia. So again, pyometra is pus in the uterus. And you can have a closed pyometra and you can have an open pyometra. Here in this picture is an open pyometra, which means pus is draining out. Closed pyometra is the cervix is closed. Remember that cervix is that muscle inside of the uterine body and will open during reproduction, so breeding, and also open during contractions. But if it is closed, hence that pus cannot drain out. That pus is going to make its way into other body cavities, and this patient is going to become very septic and could struggle with septic shock. Go think back to our emergency section and some common symptoms that you would see if we had infection circulating throughout the body, which then could compromise our circulation. Again, we may or may not see vaginal discharge. That animal can be drinking a lot, urinating a lot. It's just trying to flush that body out. We have infection, and so fever is very common here. If we have this pus draining into or osmosizing, I made up that word, into the abdomen, causing peritonitis, that can be very uncomfortable in the abdomen. The uterus is filled with pus, and in the next picture you'll see how large the uterus can be. This is going to require emergency surgery, and you are not going to salvage the uterus. This animal is no longer a candidate and will be a candidate for breeding and will be spayed. Here is some pictures on radiograph. Looks like a ginormous colon here, but no, it is the uterus. And in the previous picture, I believe, when we talked about pyometra the first time, there was a picture of the uterus when the animal was being spayed. Pseudo-pregnancy, false pregnancy, is a psychological condition. And so I think back to the movie The Hand That Rocks the Cradle. I don't know why, I'm kind of weird that way. But behaviorally, this female is going to act like she is pregnant. So she is going to gather toys around her home and pretend like she's nursing them. Her mammary glands might even become enlarged. They could even secrete milk. Her body is telling her that she's pregnant, but she in fact is not. She mothers inanimate objects. So I just think it's adorable. But again, it's a psychological condition and nothing you can do. There's no treatment. You're just going to let this animal cycle out of this and they will recover on their own. mammary tumors. So a tumor of the milk-producing gland. 50% are malignant. So malignant meaning they have the potential to metastasize. Hence, 50% of them are benign. Nonetheless, how can you determine if one is malignant and one is benign? Well, you'll have to do a biopsy. The incidence of mammary tumors is so insignificant if the animal is spayed before their first heat. So another reason to spay your animal is you are definitely reducing the incidence of unwanted animals in the world, and also decreasing, if not eliminating, the chance of reproductive cancers. And here the statistics go up slightly and significantly as we go through multiple heat cycles. Eclampsia is known as milk fever. Now, it ultimately is low calcium. And usually, eclampsia can be seen in late pregnancy or early lactation when we are milking, because all of that calcium is being given to the puppies. And so, calcium is essential for a lot of metabolic functions, and to supplement, to repair or fix the problem, we need to supplement some calcium to the animal. Now, we're not going to give them Flintstone vitamins that have calcium in it. We are going to give intravenous calcium very, very, very slowly, because we can have some significant side effects to the heart and to the gastrointestinal system if we give it too fast. Common symptoms of eclampsia is weakness in the hind legs, staggering, and if left untreated can turn significantly neurological, and they can have seizures and convulsions. Mastitis, inflammation of the mammary glands. Again, you can see in these pictures one is far more mild than that of this poor dog. We have infection in the mammary glands, which you can perceive the animal is going to have a temperature. These mammary glands are going to be hot to the touch, obviously very uncomfortable. If milk is coming out, you're not going to want to allow the puppy to nurse out of that mammary gland because the milk is infected. Treatment. Because this is caused by a bacteria, we're going to pursue antibiotic therapy. We're also going to treat this animal symptomatically, so we're going to apply some nice warm compresses to the mammary glands. Again, if the pups are old enough, let's wean them onto a different diet, but if not, we need to have them supplemented with some milk, or choose a non-infected mammary gland. Vaginal prolapse. We can have prolapse of the vagina. We can have prolapse of any orifice, really, but here is a picture of the vagina coming out. We can see it during distinct stages of the before and the during of the reproductive stages. It can regress, and so it can go back into its normal position, but eventually, but if not, you want to keep this tissue nice and moist and clean, and then seek attention from your veterinarian. If it isn't able to fix itself on its own, then the veterinarian might need to tack it in place. The uterus can also come out. So if we think of the vagina, that's somewhat of the entrance into that uterus, and so it can prolapse. It is commonly more common to occur during whelping, when that cervix is open. We typically do not see it in dogs. We can see it in cats, but again, it's not super common. Likewise, with the vaginal prolapse, we want to keep everything moistened, and then we want to put it in its proper spot. We don't want to have it out here where possible circulation can be impaired. We want to get it into its normal position, either manually or surgically. So in the meantime, until the veterinarian can do that, keep everything nice and moist and clean. Excuse me. Disorders of the male dog. We're going to talk about these guys right here, and you've probably seen cryptorchidism. This is a genetic condition, and we can a genetic condition where one or both of the testicles don't descend into the scrotal sac. Usually they should descend by about 6 months of age, but if not, this is not a good candidate for breeding, and you would want to neuter this animal. benign, so again, unlikely to metastasize. Prostate, hyper, big growth. And so prostate disease in people is, in males, is quite common, and just like it is in animals. We are commonly going to see BPH in 95% of unneutered males, older males. And to fix this, we're going to castrate this animal. But here are some pictures of the prostate enlarged. And here's the urethra. And so if it's enlarged, it can impair urethral flow, or the urine out of the urethra. So this animal can have a difficult time urinating, or can urinate a lot. Prostatic adenocarcinomas, these are cancer and of the prostate. And so we would treat this animal, we would seek attention to treat that cancer. And so treatment of a cancer could be such that radiation therapy, chemotherapy, surgery. Again, an oncologist would be the best person at addressing what therapy would be ideal for this sort of metastatic. This is usually a metastatic cancer. Inflammation or infection of the prostate gland. Again, the prostate encapsulates that urethra, and if there is infection, that can impair that urethra, and again, urine coming out. We can most likely see, because this is an infection, we can have pus or blood, common symptoms of an infection. And because this is an infection induced, we're going to treat with antibiotics. We can have some other cancers of the testicles. We can have some tumors of the testicles that produce estrogen, and we can have some tumors that produce androgens, and so that can just give you an idea that there is a possible tumor present. Again, because this is a cancer, we can remove the testicles, and hopefully if they are not metastatic, we have removed the cancer. Paraphimosis, this is not a common disorder, but this is where the penis is unable to retract back into the prepuce, the skin that encapsulates the penis and protects it. When you do see it, you want to keep it moist, obviously, and try to manually put it back into the prepuce. If that is not going to happen, you want to seek medical attention, because you can have a situation here where necrosis has started. Now, if this were worst case scenario, you would amputate the penis. Some differences between canine reproduction and feline reproduction. Here's a big one. Cats are induced ovulators. So what that means is they need something that is stimulating their vaginas to ovulate that egg. Once vaginal stimulation has occurred, ovulation is going to occur a half a day later, and we have implantation of that egg a week to 2 weeks later. Again, because of that induced stimulation, because we've had penetration. Here's the cat penis. This is the one penis that has little spikes on it and actually points caudally, versus the canine penis that points cranially. They are seasonally polyestrous, and so they go into heat in the spring and the fall, poly multiple times. Seasonal, spring and fall, poly many times. And so I remember one of my cats going into heat in the spring, and she was showing some very classic signs of being in heat, which we'll talk about in a right now, actually. Meow, meow, meow. And she was extremely affectionate, backing up her butt into me, doing the army crawl on the floor, posturing herself. And it went on all night, all day. And ultimately, she is going to cycle back and forth through estrus and proestrus without going into the resting stages. The only thing that is going to stop her heat cycle is the end of the season, or we spay her, or she gets bred. And so this was not the time where we let the cat out of the house to seek male attention. I made the appointment for the veterinarian. Tom is going to bite at the back of the queen's neck. Now, granted, I have two male cats that bite each other and kind of mount each other. That's a dominance quality. But if this is reproduction, the Tom is going to bite at the back of the neck. That's a telltale sign that mating can occur. Again, the actual process can take briefly too many minutes, and again, those little barbs, those little spikes on the penis is going to stimulate the process, the reproductive process, like we just mentioned, and they can mate many times, just like males, just like canines, excuse me. Same length of gestation. We call the act of delivering kittens queening, and we see a lot of similarities between palpation manually for the dog, ultrasound, and again radiograph. And we can have that false pregnancy occur in cats as well. Again, queening or parturition is just a general term. Queening is specific to cats, and we are going to have some signs that queening is going to occur if that vulva becomes enlarged and we have this mucus come out of the vulva. She wants to seclude herself, or just like dogs, she seeks attachment from somebody in the house. We are going to have milk coming out of those mammary glands a couple days before and from the actual nipple. So those mammary glands are going to get larger and milk is going to come out a day before. Again, very similar to that of dogs. Just like dogs, we can have kittens be born bam, 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 or we can have some resting time. If there's a lengthy time, days in between kittens, usually there's a problem, and again, we want to seek some attention. We don't have as many dystocia issues with cats because we don't have as many genetic abnormalities like those brachycephalic breeds. Queens can go into estrus 24 hours after queening, so this is not the time to let the cat out because she can breed with a male cat shortly after. And here are some pictures of active queening. Disorders of the cat, of the female cat, we can have pyometra, so pus in the uterus, although it's not as common. We can have mammary hyperplasia, so excessive growth in the mammary glands. We can treat by spaying the animal. There is also a drug available. We can have mammary cancers. Again, we see those mammary tumors more present in unspayed cats or cats that were spayed later on. No difference no different than what we discussed with dogs. Not seen in cats spayed to their first heat cycle, so we can eliminate mammary tumors or reduce the significance of mammary tumors so much by spaying them before their first heat cycle. And so again, when we think of that first heat cycle in the cat, we think approximately 6 months of age. Cryptorchid, we can see cryptorchid cats as well, toms. Now, to repair a cryptorchid, if one or both of the testicles hasn't descended, and this is true for dogs as well, is that we have to go find the testicle. The surgeon has to go find the testicle. So it's usually a little bit of a longer procedure, definitely in the cat, because in cat castration, the surgeon is going to remove the testicle by making an incision in the scrotum. So if that other testicle isn't present, they have to make an abdominal incision and search for it. With canine surgeries, canine castration or orchiectomy, the surgeon always makes their incision here, and they seek the testicle out and remove them manually that way. So it's a little bit of a different approach for the cat, and hence adds to the expense. Always remember to have your pets spayed or neutered. So I hope this helped you. If there are any questions or concerns in regards to the reproductive module, a lot of it was a nice review from VLP and perhaps vet diseases and comparative anatomy, but just went into a little bit more detail into some disorders and diseases that we see that pertain to the canine feline reproductive system. I want you to dominate this test so that we can bring up those grades. All right, thanks guys.